Good day, everyone. I'm David, the moderator for this webinar. I welcome everyone for today's webinar, which is Navigating the 2024 Medicare Physician Fee Schedule Final Rule Updates. I would now like to introduce our presenter for today, Tony L. Holmes. Tony L. Holmes, CCS, CPC, CPMA, CRC, AHIMA approved ICD-10 CMPCS trainer, is an internationally known speaker and recognized subject matter expert on medical coding, reimbursement, and revenue cycle management. She holds multiple credentials with the American Health Information Management Association, AHIMA, and the American Academy of Professional Coders, AAPC. I would now like to hand over the floor to the speaker. Over to you, Tony.
Thank you so much for that warm introduction, and thank you to all of our attendees today, whether you are live with us or listening on the playback. We're going to be talking about the upcoming 2024 MPFS Final Rule updates. MPFS stands for Medicare Physician Fee Schedule. So as our moderator mentioned, my name is Tony L. Holmes, and I'll be your presenter for today's session. So today we're going to be talking specifically about the key updates for the 2024 MPFS Final Rule. We're going to talk about the financial impacts. We're going to talk about the conversion factor, what's going on with the Medicare Economic Index, the MEI. We're also going to be talking about the impacts of the 2024 evaluation and management updates. And then we're going to talk about some of the major changes that came about for remote care services. So for 2024, our MPFS conversion factor has been reduced by $1.15. The MPFS conversion factor, so for anesthesia, we're looking at $20.43. So that's a hot topic, a big issue for anesthesia, for our ER providers. So why is this happening? This is the question that I'm getting from clients every day. Why are we getting reimbursement cuts? Medicare's come out and said, we want all Medicare lives to be tied to an ACO by 2030. High-cost chronic conditions like diabetes, heart disease, hypertension, colon cancer, breast cancer, depression, patients that are dependent on smoking. All of these are assessment screenings, tools, monitoring tools that can be used to try to get ahead of some of the most high costs. So this is why we've seen a lot of push with capturing data points like BMI. These are all part of moving the industry, moving providers to a value-based care reimbursement model. Now, everybody's talking about this G2211 code. So G2211 is a code, a HCPCS code that Medicare has created. Now, this is an add-on code that they're saying you'll list separately in addition to your outpatient or office E&M visit, new or established. Some other updates are the appropriate use criteria program. So those requirements are gone. Another really major change that's going to impact behavioral health, mental health professionals is Medicare is going to allow clinical social workers, licensed marriage family therapists, and mental health counselors to enroll in Medicare. We also have some updates for telehealth services. Medicare is also going to continue to allow direct supervision for services that are listed on the approved list of telehealth services. We also have some pretty significant updates for split shared services. So split shared services are basically services that are provided in a facility setting like the inpatient setting or the observation setting for evaluation and management services. So the big change here, we also have some new HCPCS codes, so some G codes for community health integration services. We've got 2 new G codes for CHI services. So we have principal illness navigation codes or PIN codes, G0023, G0024. And then we have peer services, so PIN peer services, G0140 and G0146. So these are for patients that have high-risk conditions, diseases that are long-term. We also have a new assessment code for the social determinants of health. So G0136 is for administration of a standardized evidence-based SDOH risk assessment tool. We also have some new codes for caregiver training services, so CTS. So we've got 97550, 97551, 97552. So with the MEI, the Medicare Economic Index, they updated the MEIs in 2017. So let's talk a little bit about the financial impact for your evaluation and management services. 99214 is our next E&M code. All right, so now let's talk a bit about the changes in the MPFS specific to remote care services. So we have remote patient monitoring, we have remote therapeutic monitoring. We got some pretty big clarifications and updates within these services in the 2024 MPFS Final Rule. Remote patient monitoring is our physiologic or biometric data collection. We have our codes for patient setup and education, which is a one-time code. Then we have our ongoing device monitoring codes for each 30 days. Then we have our treatment management services, 578, 994578, 458. With our RTM codes, remote therapeutic monitoring, these are basically monitoring therapy adherence or medication adherence, medication compliance, pain levels, things that are not biometric data points. So you can bill for 98975. And then for our treatment management services, these are specific to RTM. Medicare came out and said, yes, for RPM, you do. You have to have an established patient relationship. They said with RTM, they do not have that same requirement. Now, Medicare regulations for PTs and OTs in private practice require all physical and occupational therapy services to be performed under direct supervision by the PT or OT. So our 99457, 99458, 98980, 98981. We also have some clarification about billing for RPM or RTM during a global surgery period. Medicare came out and said, we're not going to pay for RPM or RTM that's part of a global period. Medicare does allow providers to bill for services like RPM or RTM concurrently with CCM, TCM, BHI, PCM, or CPM. Another pretty big rule, so FQHCs and RHCs can bill for RPM and RTM services separately. So before they were not able to do that, now they can do it with the G code G0511. That's pretty much it in a nutshell. You want to make sure that you're auditing internally, externally, and you're doing it as frequently as possible. Thank you so much for your time and attention, and I hope you have a great rest of your day.
Thank you, Tony. That does conclude the session for today. Thank you everyone for participating. You may all disconnect now and have a great day.